So let's discuss about ovaries today. There are two ovaries within a female pelvic system, and normal size of an ovary is normal volume of an ovary is 7 to 10 ml. Greater than that is enlarged ovary. Most common problem that could be seen in the ovaries are the cyst. What is cyst? An abnormal growth of a normal follicle more than 2.5 centimeter in size can become a cyst. It appears a simple cyst. The first type is simple cyst, that is a follicular cyst also. As I mentioned earlier, a normal follicle which overgrow in size. It is usually round and anechoic in appearance, is called a simple cyst. Here is the simple cyst, round and anechoic in appearance. There is no substance or heterogeneous material within it. It is a normal follicle which grows in size. It is more than, if it is more than 2.5 centimeter, up to 2.5 centimeter is the maximum follicle size. And it usually if the female does not have regular periods and skip the period for 2 to 3 months, the follicle can grow in size. And if the female is having the treatment for fertility, is having fertility treatment, she can develop the simple cyst. Next is the complex cyst. Complex cysts are those which contain either blood or solid substance in it. Here are the complex cysts. They show debris and thin septa in it, but it doesn't show the flow, the blood flow in it. If it shows blood flow in it, it could be the hemorrhagic cyst. So if the cyst bleed, it is called hemorrhagic ovarian cyst. It usually have thin septa and debris in it and shows flow on colored Doppler. It needs treatment. Complex cyst and hemorrhagic cyst need urgent treatment, while the simple ovarian cyst or the follicular cyst, if it grows bigger in size, more than 5 centimeter, then it need treatment. Otherwise it can break in a regular cycle. So next is serous cyst adenoma. What is serous cyst adenoma? Serous cyst adenoma is an anechoic cyst, unilocular, means a simple as cyst, single cyst, and like the follicular cyst, but it has an irregularity of wall, but doesn't show sometimes. Usually it doesn't show septation, but sometimes it shows septations, but it does not have any flow on color Doppler. It is anechoic in appearance with the wall irregularity. Sometimes show septations, but doesn't show any flow on colored Doppler. And they are usually benign. Here is the thin septations. Here is the cyst. Sometimes shows septations and mild echogenic foci. Otherwise usually irregular wall, not proper round, and anechoic in appearance. Sometimes hypoechoic or having echogenic foci and thin septations in it. So next is mucinous cyst adenoma. It is typically larger cyst, multilocular, with thin septations, contain echogenic foci, multiple septations, and different echogenicity within the cyst. What is the difference between mucinous cyst and serous cyst adenoma? Mucinous cyst is multilocular, multicystic, while is unilocular, a simple cyst, one cyst, but have irregular wall and sometimes show thin septas and show no flow on Doppler, while mucinous cyst adenoma is multilocular, multicystic, and it shows thin septation, numerous thin septation, multiple septations within the cyst, and different amount of echogenicity due to its multiple septations, and different amount of echogenicity in different parts of the cyst. So here is the mucinous cyst adenoma, echogenic foci, irregular. So here the multilocular. Now see this multiple septation. Here is the different echogenicity, and here is the different. It is hyperechoic, heterogeneous, while it is hypoechoic. Irregular wall, septas, and multilocular cyst. Here is also an example of mucinous cyst adenoma. Next is dermoid cyst. What is dermoid cyst? A diffusely means completely or partially echogenic mass with posterior enhancement, sebaceous material hair within the cyst activity. Either the whole ovarian mass is echogenic or partially echogenic, with the material, sebaceous material and hair within it, an echogenic interface at the edge of the mass that obscure deep structure. The tip of iceberg sign. Dermoid cysts show different signs. Tip of iceberg sign, dermoid plug, dot dash pattern, or also called dermoid mesh. These are well circumscribed, thin-walled, unilocular masses. Show no vascularity on color Doppler. Also show shadowing calcific or dental components, means tooth. It seems like a tooth and the cyst. Here is the dermoid cyst, unilocular, well circumscribed, thin walled, diffusely echogenic or partially echogenic, solid component, and here is the example of tooth. It seems like there is a tooth, echogenic in appearance, tooth in the cyst. It also shows some hairy appearance like these echogenic. It shows like sebaceous material hair growth within the cyst. This is diffusely echogenic, thin walled, well circumscribed, and these hyperechoic areas are the hair growth within the cyst. And the last is endometriomas, which is also called ovarian endometriomas or chocolate cyst. These cysts are filled with menstrual blood. They are the signs of endometriosis. They are non-cancerous, fluid-filled cysts and typically deep within the ovaries. They get their name from their brown tar-like appearance. Here are the examples of endometriomas. Ovarian endometriomas, usually often bilateral or multilocular. Hemorrhagic means having menstrual blood within the cyst. Here is example of ultrasonographic example of endometriomas and chocolate cyst. Can you see the appearance? They are regular, thin-walled, and dark in appearance. That's what they call chocolate cyst.